The issue with wearing dentures over a long period of time, it's going to destroy the mouth, and you will reach the point where you can't wear anything, and you're going to be very unhappy. And more than likely, it's going to be in your later years. Whereas if you put implants in, it is a lifelong investment, and yes, it is costly on the front end. But when you look over 5, 10, 15, 20, 25 years, you're going to look back and say that's probably one of the better things that I ever did. But there is that initial, wow, those are expensive compared to not having any implants in at all. But the consequences that you pay later on in life are excessive. There's never a point of wearing dentures and you're better 20 years later for wearing them. There just isn't such a thing. It's going to do some destruction of the tissues. I think I had a patient just yesterday who said to me, now we were finished with the implants, and she said, now I understand that they're only going to be good for about 15 years. And I looked at her and I said, well, I hope not. I've got 8 in my own mouth, and I'm planning on having them a lot longer than 15 years. I said, where did you hear that? And she said, oh, I thought I read it someplace or heard something. I said, you know, there were times when they were doing hips and knees that they would put a timetable on it. But in dentistry, we have not had a period in which we expect these to be, coming out. You may have to have a crown redone on the implant, but the implant should continue to be in bone and be very healthy. So I think there's some misunderstanding on that end. One of the things I was alluding to before in regards to where dentistry has come, a person loses one tooth. With the loss of the tooth, we cut down 2 perfectly good teeth for crowns to make a bridge. Insurance companies, for as much as we don't like certain things about them, there's one thing that they have done, and they've kept a database on all the work that's been done for any individual, and we now know that a bridge is basically good for about 13 to 15 years, which means something has happened to that bridge. It may be as simple as just a fracture of the porcelain, but most of the time the cement breaks down, decay comes up underneath, and all of a sudden you need to do a root canal on one of the teeth, or possibly you even lose the tooth. So now the dentist has to go to another good tooth to cut it down, and now we have a 4-unit bridge. And as we watch our patients on a decade basis, we see that they go from a 3-unit bridge to a 4-unit bridge, and sometimes we'll even stretch it to a 5-unit bridge. Or now they have to start to wear something that's removable. And with the removable, it's like wearing a crowbar, because that constant clasps that are hooked onto the natural teeth will cause them to eventually loosen up, and then you start to increase the size of your partial, and ultimately the end result is that you go to the denture. And that was pretty much where we were in the 70s, the 80s, the 90s. When implants came in, it all of a sudden started changing this whole dynamic. If you have a tooth that's missing, we replace it with an implant and a crown. We don't touch any of the other good teeth. I don't think the effects of that are going to be felt, probably not within my years in dentistry. But as the years go on, all of a sudden dentistry isn't going to have all this repeated work that we have to do, redoing bridges, partials, and whatever. Even if you take a partial, which is removable, and put one implant in so the partial snaps onto the implant, you increase the length of the life of all your other natural teeth. There's just so many parts to the implant story that we're just beginning to, understand the longevity of it. And I think dentistry is looking at this a little differently nowadays. I don't think we really looked at it as clearly. If we go in and do one procedure versus another procedure, which one is going to end up lasting the longest? And yes, maybe the one is more expensive up front, but when you compare the repeated redoing of things versus doing something that's going to last a long time, for instance, an implant's not going to decay. Made of metal. You'll never need a root canal because there isn't a nerve in there. So, and they don't fracture. There's certain sizes that we can have a problem, the real narrow ones, but any of the larger ones, we haven't had fractures of implants or whatnot. So for the most part, you are replacing something that some of us think may even be better than the tooth itself. Add one more factor that we're learning, and that is as we age, our saliva slows down. It's a natural occurrence of aging. We knew that saliva was important in the restriction of decay, but we really didn't understand how important. And nowadays we're noticing there's over 400 medications that dry our saliva up that you can either get over the counter or by prescription. As we age, and we're all aging and we're living longer, the mouth is drying up more. And guess what? We're going back to an era where we're having rampant decay in the elderly patient. Geriatric dentistry is in its infancy, but it's going to be an area that's going to be vitally important. Just today I was on the phone with a referring dentist, and what she said was, here's a patient that's in a nursing home. He is about every 6 months losing another tooth to rampant decay, so bad that she can't restore it, so we're extracting it and then putting an implant in. We feel better because we know that it isn't going to break down with decay. Now we're looking at it and saying, well, when do we finally sit down with the patient and the family or whatever and say, maybe it's better that we take out these other teeth, because you don't want to sit there and keep on charging patients one after another. Let's look at this as a total, what's the best for the patient long term. But that's a huge area that's going to make a big difference for us. And I think as we learn more about, under these circumstances, for instance, a number of the drugs they use for Parkinson's patients, I don't know what it does, but it really destroys the mouth's ability to fight the decay. And because of that, these patients really lose their teeth very quickly as 6 to 9 months, perfectly healthy teeth. So the answer is go to an implant that's metal so that we don't have to worry about that aspect of it. Implants will develop periodontal disease, and that's another whole new field that's starting up now. It isn't like it's the answer to everything. You do have to clear up periodontal disease before you start putting implants in. If you go in and just drop a whole bunch of implants in and you've got some uncontrolled periodontal disease, you've got a good chance that those implants in a period of time are going to develop the infection too. So it's surprising. I'm doing more periodontal treatment surgery on implants now rather than just teeth. But what we call a failing implant. A failed implant is one that's lost enough that it's loose, and then there's no hope. It isn't like a tooth where we can keep it a while. We have to take it out.